So we all know what a stye is. It's kind of like a pimple. It develops when bacteria invades a gland in the eyelid and causes infection. But how do we get rid of a stye? Well, first you should know that there are two different types of styes, and each type is treated differently. So let us elaborate on the different types of styes and how or what medicine will get rid of them. The first type of stye is called an external stye because it forms on the outer edge of the eyelid at the base of an eyelash follicle. It looks just like a pimple. It's caused when Staph aureus bacteria gets trapped in the gland at the base of an eyelash. External styes are usually not severe in terms of pain and swelling, and they usually go away on their own within 5 to 7 days. But sometimes you can make them go away quicker, and here's how you do it. External styes form when Staph aureus gets trapped in the gland of Zeiss and causes an infection. It's at the base of an eyelash. This is the gland here. So the first thing you should do to get rid of a stye is to apply a warm, hot, moist compress to the stye for about 5 minutes. The washcloth should be as hot as possible without causing damage to the eye. The purpose of the hot compress is to liquidize the thick waxy secretion or the pus that is stuck in the gland. Next, pluck 1 or 2 eyelashes closest to the stye. So what you want to do would be to pluck 1 or 2 lashes that are closest to the stye. So if the stye is here, you would pluck this lash. Then, after you pluck the lash, massage the area to try and push the infection out of the eyelid. You should also try applying a moist green tea bag or tea to the eye after plucking out the lash. Green tea from the Camellia sinensis plant has been proven in clinical trials to inhibit the growth of Staph aureus. If that doesn't work, apply a warm, moist compress to the stye as much as possible. The purpose of this is to bring the stye to a head. Once it comes to a head, some people will puncture it or pop it. Once you pop it, it heals immediately. That should work to get rid of an external stye. But what about an internal stye? The second type of stye is called an internal stye because it develops deep inside the eyelid. Internal stye is when Staph aureus gets trapped inside one of the meibomian glands and grows bigger and bigger. They can get very red, large, and painful within 2 days. They can grow large enough to close the eyelid. So this is the meibomian gland. And this is where internal styes form. Some people who get an internal stye might get reoccurring internal styes or multiple internal styes, or they get one internal stye after another. It's not uncommon for people to get 2 styes in the same eye at the same time, or 2 or more styes in both eyes at the same time. Some people think internal styes are contagious because they get several of them, but they're not contagious. Just for reference, there are approximately 50 meibomian glands in the upper eyelid and 25 in the lower eyelid. People who get an internal stye or multiple internal styes usually get them because at the moment their meibomian glands are dysfunctional. It's when, for some reason, they just aren't working correctly. Dysfunctional meibomian glands can start acting dysfunctional for many reasons. It could be from certain medication, hormonal changes, environmental conditions, or because of disease such as MGD, also known as meibomian gland dysfunction. When meibomian glands become dysfunctional, the glands start producing poor quality tears. It's more of a thick, waxy secretion. This allows Staph aureus to get stuck in the gland and cause infection. So if one gland is acting dysfunctional and develops a stye, it means all of the glands in both eyes are likely dysfunctional, and a stye is capable of developing in any of them. So the big question is, how do we get rid of them? The first way, and by far the best way, and possibly the only way to get rid of an internal stye, is to take doxycycline hyclate. Doxycycline is an antibiotic of the tetracycline group, and ironically this medicine is completely incapable of killing a stye. That's because the bacteria that causes a stye is resistant to doxycycline and basically all antibiotics. But oral doxycycline has an interesting side effect in that it rapidly restores lipid properties of the meibomian gland secretion above normal and eliminates signs of plugging, and it works very fast. So let's say you feel a stye developing, but your eye has not yet become red, swollen, or painful. If you start taking doxycycline at that moment, it will kill the stye before it develops any further. That means your eyelid will never get swollen. Doxycycline has also been shown to dissipate a matured stye faster than without treatment. By the way, when I would take the medicine, I would discontinue its usage after all signs of or symptoms of the stye were gone, which was usually within 3 days. Now, most people aren't going to know they have an internal stye until their eyelid has already become swollen. But you should know about this medicine because there is a good chance you will get another, and then you might want to consider it. You can get doxycycline at any local pharmacy. You can also go to goodrx.com and print out a coupon. With the coupon, you can get the medicine for as little as $15. But you will need a prescription. If your doctor's office is already closed or you do not have a doctor, you can get a prescription at a mini clinic at any time. So besides doxycycline, what are other ways to get rid of an internal stye? Well, probably nothing. I would recommend applying a hot compress as much as possible, but do not apply the compress with too much force. Doing so can actually cause another stye. You can also use ibuprofen to bring down swelling and pain. It actually works pretty good. Lastly, try green tea. In my opinion, it's worth a shot. Lastly, there's something called a chalazion. A chalazion is the remains of an internal stye that never healed, meaning it never ruptured or popped and spilled its contents. It can last several weeks, months, or more than a year. Often it requires a simple surgery to remove it. They can grow to the size of a small pea. This is why it's so important to treat an internal stye when you get one, to avoid a chalazion.